Well, hello, it's Bruce Williams again, and today I would like to bring my series of lectures on the pathology of laboratory rabbits and rodents to a close with a short presentation on the pathology of the gerbils. As I do at the beginning of all of my lectures, I want to thank those friends and colleagues who, through their great kindness, have provided me these images over the years that allow me to put these lectures together. So let's talk a little bit about gerbils. Gerbils are very interesting animals. Remember, they are desert animals. And so they have a few little kinks that enable them to live in very arid parts of the world. They're unique in a number of other ways. The lifespan of the gerbil's red blood cells is only 10 days. And if you take a look at a peripheral blood smear, their lymphocytes predominate in the normal state in the blood at 3 to 4 to 1 over granulocytes. They are normally lipemic and hypercholesterolemic on standard diets. We traditionally think of them in sort of this agouti color, but pet gerbils are very popular, and they come in all sorts of different colors, like black and spotted and Burmese, and the people who love their gerbils truly love their gerbils. There are a couple of other gerbil-like rodents that are of interest. On the bottom left here is Samamis obesus, the fat sand rat, who is widely used in research. It's gaining a popularity due to a predilection to develop diabetes mellitus on normal rodent chows, and it also has extremely effective kidney function. Gerbils and similar animals have very large medullas, and they concentrate their urine to a very, very high level. It's almost like when they urinate, it's a puff of yellow dust because they can't afford to spare any water. They're not big water drinkers. Most of the water that they take in is from their foodstuffs, like seeds and nuts. So they have to process it, and they have to conserve it very carefully. Here's one that's sort of cool. This is the great gerbil. It's Rhombomus opimus, and it weighs up to half a pound and is 7 to 8 inches long even before you start counting the tails. That'd be sort of a fun pet, I suppose. We looked at hamsters who have paired dorsal marking glands. Well, the male gerbil has a ventral marking gland. It's a modified sebaceous gland. And unlike the hamster, where it actually does some work in the processing of testosterone, it's pretty much just a modified sebaceous gland used for marking territory. And the big thing that it does is act as a site for cutaneous neoplasia. And histologically, this old picture shows what it is, just a tremendous number of cram-packed sebaceous glands. Gerbils also have extremely large adrenal glands, possibly the largest pound for pound in the rodent family. They're about a quarter of the size of the kidney and about 4 times what we see in other species. The pups that are born to gerbils aren't precocious. Their eyes don't open until about 3 weeks, at which time they can be weaned. Unlike guinea pigs, as we saw before, who come out pretty much fully formed, fully haired, and their eyes are open. They're ready to run around as soon as they hit the ground. One of the problems that you can have with gerbils is if there's a lot of environmental disturbance, the mothers may cannibalize the young. Okay, let's look at the diseases of gerbils. And they don't have a lot, or maybe I don't have a lot of them, I don't know, but not a lot to talk about. So one of the biggest problems that is seen in gerbils is this ulcerative lesion on the nose. And this goes by a number of names in the lay press, such as red nose or sore nose. And gerbils, like some other creatures from arid environments, they have to take sand baths. You put a little dish in there, very fine sand, and they go in and they rub it all around and they scratch, and that's their sort of equivalent of bathing. And if you do not provide them access to that, they will accumulate porphyrin pigments within from the nasolacrimal duct. And these porphyrin pigments will travel to the nose, and they will come out, and they will stay on the skin where they are extremely irritating. So they'll irritate the nasal skin, you'll have ulceration, and you will commonly have secondary bacterial infections with Staph aureus or Staph xylosis as a sweet sequel, and the hair will fall off, and they call this red nose or sore nose, a big problem in gerbils. Don't pick up a gerbil by the tail. They will undergo something called tail slip. It's a degloving injury, which is used to escape predators, and no, it doesn't grow back. So we don't pick them up by the tail. Another problem that is seen in gerbils is epilepsy. Very common in Mongolian gerbils under stress. Up to 40% are afflicted with this condition. It's a lot of fun when a little girl comes out to show you her gerbil. You clap your hands and then see if you can precipitate a seizure. No, don't do that. That is not a nice thing to do. It's not a nice parlor trick, but just realize that epilepsy is one of the things that Mongolian gerbils will display, and they're used a lot in epilepsy research. There's no histologic lesion associated with epilepsy, though, so don't go looking for a nidus or a focus or something like that. This is a picture of the brain of a gerbil. No real detail here, but just to remind me to mention that gerbils they have an incomplete circle of Willis, which makes them prime candidates for use in stroke research, because you can ligate the common carotid artery and result in ischemia to a large section of the brain. So because they don't have that collateral circulation that most animal species do. Here's a gerbil with, and it's tough to tell from this picture, but this gerbil has a head tilt. It's got torticollis, and the head tilts are a common presenting sign of cholesteatomas of the ear, so the so-called aural, A-U-R-A-L, not oral as in mouth, but oral as in ear, cholesteatoma. And this is not your typical cholesteatoma, which you see in horses or sometimes in the ventricles of the brain of old bears, which is which arises from chronic repetitive hemorrhage, and that cholesterol in them is the breakdown product of erythrocytes, which has a foreign body reaction and calls in macrophages. That's what we see in the ventricular system of horses. In humans and gerbils, which are the animal model, the cholesteatoma is a little different. Cholesteatoma, it arises from the external surface of the eardrum and the auditory canal. Up to 50% of gerbils have, over the age of 2, have these oral cholesteatomas, and it arises from the epithelium, and it can form these large polypoid inflamed masses. People get them too, and the compression that it causes in the internal ear can result in destruction of the inner ear structures, the eardrum, the bones of the middle ear, and the temporal bone. This one has been sort of, the outside. Normally the bone or the cartilage comes up to here. It's been taken off, and you can see this proliferative lesion. So it's an animal model for oral cholesteatoma in people, and it looks very much like this. A lot of inflammation, a lot of cholesterol clefts forming these sort of spicular extracellular structures, and macrophages in between. Gerbils are the most sensitive species for Tyzer's disease caused by Clostridium piliforme. We've talked about Tyzer's disease in a lot of other rodent and species and rabbits. It is a normal commensal in rodents and lives very happily in the large intestine and a little bit in the cecum. And when there is dysbiosis, when there is a disturbance in the force, or at least in the flora of the large intestine, often precipitated by the administration of antibiotics, then it will overgrow, it will release toxins that allow it to get into the wall of the large intestine. It will live very happily for a short period of time in epithelial cells, then result in necrosis. And ultimately, that will be followed by infiltration of the portal venous system by the bacteria, and it will travel to the liver and cause multifocal areas of necrosis. Ultimately, if that doesn't kill the animal, it will go to the heart and get into the cardiomyocytes and cause necrosis, and that is definitely going to kill the animal. But gerbils are absolutely the most sensitive species before the days of PCR, and it's very difficult to culture and grow Clostridium. But before the days in PCR, if you thought you had Tyzer's disease, or you'd had outbreaks of Tyzer's disease, every couple months you take a bunch of dirty litters from other cages and put them into a single box, and you put some gerbils in there, and if there was any Clostridium piliforme in there, they would die. So they were like the canary in the coal mine as far as Tyzer's disease. Nowadays, you can just run PCR on the litter. You don't have to worry about having gerbils around to see if you still have Clostridium piliforme in your research facility. Clostridium is a bacteria that lives for a long, long time in the environment, so it's very difficult to get rid of. And in the liver, you'll see these areas of bland necrosis. There isn't a lot of, at least initially, there isn't a lot of inflammation. If you have areas of necrosis and the animal survives, eventually you're going to get neutrophils and macrophages, but generally what you see are these areas of necrosis. And if you look carefully around the edge with a silver stain or even a Giemsa stain, you will see the very characteristic long filiform rods of Clostridium piliforme within the cytoplasm of the degenerating but not dead liver cells. And they form these sort of, some people call them haystacks, some people call them pickup sticks, if you played that game like I did when you were a kid so many years ago. And but you just have to look. You can see them on H&E as well if you have a very careful eye and a little bit of patience. So that's Tyzer's disease. Diarrheal diseases, other than Tyzer's and gerbils, Salmonella may be seen as an epizootic in weanlings, and you will see the very traditional lesions that we see in rodents with salmonellosis. Remember that they generally manifest more of a septicemia than a diarrheal disease, but you will see enteritis, you will see multifocal necrosis in the liver, and if the animal survives for a length of time, you will see the formation of the so-called paratyphoid nodules, which are just areas of necrosis which have been infiltrated by neutrophils to clean it up and subsequently by macrophages, and seem to resemble the nodules seen in paratyphoid in people. So because so much of the early laboratory animal pathology was done by human pathologists, they just said, oh, there's the paratyphoid nodules. And unfortunately, that name stuck. And they look like this. Okay, we have some healthy hepatocytes around the outside, and then these areas of hepatocellular necrosis are being cleaned up initially by neutrophils, and now we're sort of in the second stage. There are a lot of macrophages in here. If you see these little ring forms, okay, see these little donuts, those are immature neutrophils. Those are band cells or even metamyelocytes. And they characteristically have the nucleus of little donuts. So if you see that, that's what those are. In the last lecture on hamsters, I showed you a very nice picture of Rodentolepis nana, which used to be Hymenolopus nana, but it's been renamed. And it is a fairly innocuous cestode that you can see in a range of laboratory rodents. Remember, as we said before, they do tend to share their parasites a bit. So you can see mice and rats and hamsters and gerbils sort of swap out various parasites of the enteron and of the skin if they're kept in close proximity, like in pet stores. So don't be surprised to see Rodentolepis nana in a wide range of rodents. And it is a cestoparasite where the embryo, it has this really nice rostellum, which is actually birefringent. And this one's up here in the lacteal of this villus. This is in a fecal flotation. You can still see this armed rostellum, these little spikes. And so it doesn't really cause much of a problem. Rodentolepis nana. Here's a pinworm. Everybody has pinworms, and rodents definitely have pinworms, and they really don't cause any problem. I like the pinworm of gerbils because it has this really cool-looking, sort of flattened, flying saucer-shaped egg, and it has a cool name. It's Dentastomella translucida. I just like to say that, Dentastomella translucida. They'll also get Cephasia ovulated and probably Spicularis tetraptera as well, but pinworms don't cause any problems in this species, nor do they do in most species except for some of our great apes. Another nice picture of the really cool looking eggs of Dentastomella translucida. Here's a really nice picture by Jerry Ward. Thank you, Jerry, for this one. And we are in the intestine. And if you look in the lumen of the small intestine, down in the crypts, you're going to see a lot of little protozoa. And they get two especially. One is Giardia, which you're probably familiar with. And then the other one is Spironucleus muris. And Spironucleus muris has been called hexamina as well over the years. And they generally live very nicely in the crypts of the intestine, don't cause any problem. In animals that are severely stressed or immunosuppressed, they may come out of the crypts and cause a life-threatening systemic infection. And that's also been identified in rhesus monkeys as well. But usually they cause absolutely no problem. But in the crypts of the intestine of rodents, especially hamsters and gerbils, you're going to see a lot of trichomonads, and it's absolutely a normal thing for them. Well, here's a bad-looking kidney, and we see bad-looking kidneys in old rodents of all types. You have to expect it as they get older. The common lesion of aging gerbils results in a thickening of the glomerular and the tubular basement membranes and a lot of protein wasting and protein casts. Remember that chronic progressive nephropathy of rats is the sort of benchmark disease that we see, but all old rodents are going to have terrible kidneys. So just expect it. Mites, old hamsters, gerbils tend to have a lot of mites. We all have mites, and they do too, but as they get older, they get sort of immunosuppressed, and so you'll see areas of hair loss, and you will see exactly the same ones that we see in the hamsters, and you can see them in other rodents. Demodex aurati, which is a little more pathogenic than Demodex crisseti. And usually in gerbils, you'll see the lesions over the back and the rump. In hamsters, they tend to be a more diffuse thinning of the hair. So that's Demodex. Here's a male gerbil, and we have that ventral marking gland. And these glands, as we said before, don't do all that much except for some scent marking, but they do give rise to a number of cutaneous low-grade malignancies, sort of a combination, either because they're a combination, like the Zimbel's gland of the rat, of sebaceous and squamous. You can have tumors that are a mix. You can have tumors that are primarily sebaceous. You can have some that are a little more heavy on the squamous cell carcinoma. They tend to be ulcerated because they're on the ventral surface. They can look really, really ugly. And that'll happen anytime that you have squamous cell carcinoma, because the production of keratin in neoplastic cells often causes an intense inflammatory response. So this is probably just a baby tumor of the ventral marking gland. Just a couple more neoplasms. We're looking at the ovaries. And granulosa cell tumors are one of the most common neoplasms in gerbils. Obviously, only the females are going to get this one. Only the males are going to get the ones of the ventral marking gland. But they tend to look like fairly typical granulosa cell tumors. Don't have a lot of the Cholesteatoma bodies, tend to have a lot of necrosis and hemorrhage. But if you do see any gerbils, and certainly gerbils don't make up much of any of my diagnostic practice, this is something that you will see in older gerbils. Another thing that gerbils have fairly commonly, and as we see in other laboratory rodents, are adrenocortical tumors, this being an adrenal adenoma, usually subclinical. Finally, cataracts. Old gerbils will have cataracts. Old rodents will have some spontaneous cataracts. There are probably lines of gerbils that have an increase in cataract formation because, especially something like the fat sand rats, because when you get diabetes mellitus, remember that the lens gets all of its, there's no inherent blood vessels in the lens, so it gets all of its glucose from the aqueous humor. And if you increase the amount of glucose in the aqueous humor by giving the animal diabetes, too much of that's going to leak into the lens. And the lens has a limited capacity to produce it. And eventually it is going to overload the Embden-Meyerhof pathway at the level of sorbitol dehydrogenase. And those are great names if you like to remember that kind of stuff. Obviously I must, because it's coming out of my head. And so you tend to, it stops right there, and you have this high level of sorbitol within the lens. And that sorbitol will bring in fluid, result in the explosion of the lens fibers. And so you get these Morganian globules and a nice cataract. So gerbils get it primarily because of the incidence of diabetes mellitus that we see. And that actually brings these lab animal lectures to a close. I hope that you've enjoyed them. I think that the next on my plate, as the JPC transitions after the Thanksgiving holiday, we're going to start talking about poultry. So I hope you'll hang around the Foundation website and YouTube channel for a series of poultry lectures. Certainly I'm not the best on poultry, but I know my way around a good drumstick. And here's one of my favorite stories about Sooty, and I'll leave you with the story of Sooty the guinea pig. And thank you for listening, and I hope that you've enjoyed these lectures. I hope everybody has a fantastic day. Goodbye for now.